Hello. Lucy, I cannot hear you. You should to turn off the... could you accept it?
Okay,
yes.
now?
Yes, I
Better?
can hear you. Better.
Okay. Okay,
So,
sorry because I am a little late because today the traffic it was full and my children was ill and
okay.
my car doesn't work. Everything's today.
So how are
okay.
you?
Fine.
Okay.
A little busy. Always I am busy.
Okay.
Okay. Could you yesterday to the preparation, the topics we are going to talk today? If you want, I think it's better I share my screen and we see in the same time. But
okay.
I am not sure if I share my screen, if you can
yes,
see
it is
myself.
possible. It is possible.
Yes.
As
okay.
you can see below part of the video, so there is a shared screen, right?
But you have to access to me, please.
Wait a second.
I have stop.
이거를 어떻게? 그러면 또 저장해.
You don't allow me.
Maybe I give you the authority of this room, so I think you can do.
Wait. Now, okay. So wait, I am going to look in PPT.
So she is my colleague, Sally.
Hello, Sally. I read in the WhatsApp. It's a new commercial managers, sales, or physiotherapist.
스페인에 있는 물리치료 의사고 이제 윈백 스페인 쪽에 전적으로 하는.
Wait.
Art S. Yes, correct. That's good.
Yes. You can see winback
yes.
intimity. Yeah?
Yes.
Better. Okay. Before to start, Nicole asked me don't say any name of you because then you want to use this webinar and she prefers I don't say any name, so only say you. Okay.
Okay.
And I am explain something, and when I finish some protocols, I stop and I ask you if you have any
questions.
Any question. Okay.
Okay.
Okay. We start. Winback intimity. How to use and clean the electrode. Okay. Is the main important thing to remember because there is a special electrode, CET. We can't sterilize with some products. So if we use very hard liquid, we can broke. And when we use in pelvic floor, I have my bottle here, we have to put a sound cover.
Okay.
Do you know what is? Then when I do practice, I will show you. Okay. And the other electrode, RET electrode, is best because it's iron and we can sterilize with everything. It's no problem.
Okay.
And when I use in the pelvic floor, I can use all the time RET. However, with some pathologies, we need CET electrode. Okay.
Okay.
Multipolar are the same RET. However, we can immerse into a liquid, so we can sterilize a lot. for the same, we can use directly in the vagina, only in.
Okay.
Okay. Then CET. This is the way we have to use every time. We can use a cover like this, or if we haven't have any cover, special cover, we can use a glove. Okay, a glove. It's possible. Sometimes when I use a big electrode, wait.
되게 그 도자 갖고 와보세요. 인피니티 도자 박스. 그거 일단 연정 씨 옆에다가 둬요.
네.
그 이해 안 되는 부분이 있으면 체크 다 해놔요.
When in pelvic floor, I like to use this size of electrode because I can treat everything, and it's a better improve a lot in the treatment. So for this, there isn't a special cover, so I have to use a glove. Okay, but we have to remember we have to use cream inside of the electrode, then a cover of gloves, and then cream again. Because if we don't use cream between gloves and electrode, the current don't cross. Okay. This is very important to use CET electrode because in soft tissues, in depth and surface muscles, this electrode is the best because it gets us vascularization in general, and in acute pelvic pain, it's very comfortable for the patient, and we can get the water retention goes down, okay? And when there is some disorders in vaginal mucus and edema, or inside even in uterus or rectus, we can use this in deep CET mode, okay? I know this electrode is a little worse than the other because we have to use gloves or cover, but it's very important to use that in the first moment. In all treatment, normally, even when I only want to treat with RET, 1 or 2 minutes, I use this one electrode after before the treatment. Okay?
Yes.
Then this is the other RET electrode for intimity, but we can use a little size bigger, or even I use a lot the big. The normal with I use in body is the same because this electrode I can't sterilize at all, and this is the first electrode I am investigating, and because I got a lot of results in very amazing results and effects in prolapse. Then I will show you.
Okay.
And this is the electrode specialized for ligament, and when we have chronic tears or scars in episiotomies, prolapse after the birth, or any surgery in abdominal, not for vagina or for pelvic floor, even from the stomach or for another disease, the scar and the skin are fibrous. So we need this electrode to break and to return this lacking tissue to be good, okay? And multipolar, this is like this, only we can use on the surface, only across 1 centimeter or 1.5 centimeters, no more. So we can use only in the skin. Okay, today we are going to see this protocol. I put different topic, and in each one we are going to see different disorder.
Okay.
Okay. Now everything's clear. Continues?
Yes, continue, please.
Yes. And the protocols for abdominal and vaginal inflammation post-birth in acute, we will see how to use. Okay. Then in dyspareunia, do you know what does it mean, dyspareunia?
Let me check.
Okay. Dyspareunia is disorder in women when they have sexualization and they feel pain inside. Okay. Okay. Do you understand? And endometriosis.
Yes, please. Yes, please continue.
Okay. Endometriosis is another disorder, but there is a type of tissue who burns in another place where they shouldn't burn. Okay. It's like it's a type of inside tissue of uterus who burns in another place, like ovaries or head even, okay? And then we will see chronic pelvic floor. This is very typical, and there is no much studies about that, and there is a lot of multifactorial etiology, okay? Then we will see disorder, more typical disorder in pelvic floor, like incontinence, tears after birth and episiotomies, and prolapse. And then I will show you how to work in abdominal diastasis and cesarea.
Okay.
First, abdominal and vaginal inflammation. Okay. During the first, between 3 and 6 weeks, I start to work. In Spain, I don't know there in Korea, but in Spain, physiotherapists, specialists in pelvic floor, always advise us we can't start the treatment after the 6th week, but I am not agree. So I start the treatment so early as I can. Okay.
Okay.
But in this PPT, I only show you after the 3rd week. But myself, I treat even 4 days after the birth. Okay.
Yes.
But winback doesn't talk about that. Only me.
Yes, it's not an official one.
No, okay, it's official.
Okay.
Well, in the first 3rd to 6th week, it's very important to treat the water retention, because after the birth, abdominal was empty or is full with a lot of water, and the uterus is so big still, and during about the weeks, the uterus goes down to her normal size. And when we use winback, we can treat a lot, and the uterus goes back and return to the normal size so fast and very quick and without pain. Okay.
Okay.
So we have to use CET a lot, but I use on abdominal, directly on abdominal. Okay. Then we are going to see 1, 2, 3, 4 scream, and then I saw on my colleague, okay? And you see specific how to use, right? Okay. It's very important to use low pulse in this week, because we need the current wasn't too strong. So in this way, low pulse, do you remember, we can't stop and a half second and another half second is working. So it's better to produce a drainage. And we will use, of course, dynamic mode, because in this way we can treat all layers of tissue, even uterus, even muscle, abdominal muscle, transversus, and skin. So, normally in winback recommendation told us we have to do in cold temperature. But when I see the water retention is not too hard, too big, I start to put a little heat. It's very important to treat with heat because the effect will be a bit better, okay?
Okay.
Much better. But the main important of this picture, I want to recommend you when you your physiotherapist is you have exercise always, even the next day after the bath. I don't mind if it's so acute. I will do the exercise I can. Even after the bath, I only have to breathe. Okay, it's enough, but it's very important the muscles are contract and relaxed because the current goes into much better than if the patient is having a rest, okay? So in this picture, I put you breathing and training transversus abdominal because this is the most important thing we have to start to work in my patient in the first session. I will show you in a minute, okay?
Okay.
Then we can use automatic mode because, for instance, I can do a treat during 15 minutes with my hand and asking her how to do exercise. But when I finish, I ask her, now standing up, and we are going to do exercise yourself. And I put the fixed electrode, one in the abdominal and the other in lumbar or sacrus, and ask her to do exercise about his abdominal girdle también. But I ask her to put on a wood. I will see you because this is a special technique from physiotherapy. So I imagine you don't know anything about that, okay? And after 6 weeks, when the inflammation is so weak, we increase the temperature and I put 40%, but I don't like a lot to say the numbers because it depends on a different patient. Because if I have a fat woman, perhaps I can use 60 with the same heat. However, if the woman is so sensitive, perhaps I only can use 20. But I put 40, but more or less, it's not exactly, okay? And it's very important to increase the heat was comfortable, but I need heat yet because after the 6 weeks, the inflammation goes down and I have to recover at all the abdominal girdle, okay?
Okay.
We use in this way doing Pilates or hypopressive exercise or anything I need to do. If I see my patient doesn't know how to breathe correctly, I teach that. If I see she has so weak the muscle of her pelvic, I do that exercise, right? And finally, for the inflammation topics, directly on the vagina. And this is very important to use, but I told you when I went to Korea that I use on the hurt and scar, but in this picture, I will show you how to use one the scar is okay, about 3 weeks after the birth.
Okay.
Because we have to use cream, and it's very important all hearts are okay, correctly closed. Because if we use cream and there is some I don't know how to explain you. If we see some injuries is not closed at all, we can produce a bad problem with infectious. Okay? We will use CET dynamic and low pulse using conductive cream between electrode and proof cover, and then another film of cream between cover and skin. Yes. In the first moment, we use cold or warm. Then I like to use, very important to remember, the RET, but in low beat. In low beat, we add, besides the radio frequency current, another type of current that pulse. So it's very important to drain it a lot and to effect in painful. Okay, this I will use directly on the skin with the cream, but not hide, because when I use low beat, it's a little uncomfortable. Okay, and in vagina much more because it's more sensitive.
Sensitive, yes.
Okay, then I will use razors. Okay, and I put, this is important to remember, too, double gloves.
Yes.
Double, because when I am using a lot of time the current across my hand or my gloves, the gloves can be permeability, so I am not sure to take off on my patient. I have to put 2 gloves. Okay. But in this way, I haven't to use cream after, before to put gloves directly on my hand, and then only cream to the skin.
Okay.
And when I am inside, can you see? Okay. I put in vagina, and when I am inside of the vagina,
yes,
I will do massage in all part of the vagina, a little massage or manual lymphatic drainage. Okay.
Yes.
I put you here after the wound and suture are closed. This is very important.
Okay.
For the infection. Okay. Well, now if you want, if you have any question, and if not, I am going to translate my table with my colleague, and I show you how to use the abdominal inflammation disc between low pulse and dynamic, and ask her how to breathe and to use with fix on a wood, only a minute, and it's so easy to understand.
So,
and to do exercise, because in this picture we can do with the fixes electrode or with the electrode. Okay. I can do in 2 times.
Yes, both ways.
And this we are going to do with my colleague. Okay. Only with the model.
So I have a question. Okay, so officially you said it is possible to do the treatment from 3rd week after the birth, right? So during the 3 weeks, so how many sessions in a week normally?
I normally do only 1, but if in the first session, if it's too acute and there is a lot of water retention, sometimes I recommend to come to my clinic 3 times continuous. For instance, Monday, Tuesday, and Wednesday, 3 days continuous. If I see a lot of water retention or if the pain is so high.
So however,
tell me.
So however, only you will do like a low intensity in order to drain the the vascularization. So in order to prevent the inflammation.
To prevent, or
No.
if the patient have prevent
No,
the
I mean,
inflammation.
if you use like a low pulse with CET, it means that we will not bring the other effect. We only do for the like a drainage, right?
Yes, I do the drainage with the winback. I don't mind if the patient have a lot of water retention or not. Depend on the patient has or not. I will use more or less heat because my intention is to work so high heat as I can, because the effects will be more fast and more better. But if the patient comes to my clinic and I see the water retention is low, I have to treat in cold and low pulse. But perhaps there are women who, when they came to me 3 weeks, the water retention is okay because her metabolism is okay. So I have to treat, to finish the treatment so quick as I can. But I have to check every time.
So how can how can you diagnose the patient whether they have a water retention or not? How can you like measure the condition of the patient?
The condition, so you have to see, because when I touch and when I see the abdominal, you will see. If you need some information, perhaps I can check on my picture, and after that I send you. But in vagina is very common to see a lot of inflammation after the birth, but in abdominal too. But in the first, only with one session, the water retention goes down a lot, incredible. Then the next session was a little slow, but the first session was amazing.
Okay.
Yes, we'll see. Okay, we translate to the other room.
Okay. 그러니까 루시아가 말하는 워터 리텐션이 뭔지 알아요? 네, 근데 배뇨가 작아. 그러니까 웃음을 못 넣는 그런 거.
Hi, can you see? This is my colleague, Maria Jose. Hello. She is physiotherapist. She works with me. Lion?
그래서 이제 순서를 배 처음에 드레이니지 하는 거, 그다음에 오토매틱 모드로 어떤 식으로 운영시키는지, 그리고 이거를 보여주려고 하는 것 같은데 그냥 아무렇지 않아. 일단 봐보죠.
Okay, can you see?
Yes, yes.
Okay. I normally use this return plate because it's more cheaper.
Yes.
Okay. I put only cream on the return plate when the temperature, as I have to work, is so high. If I am going to treat with a warm or cold, we don't use cream on the return plate. Okay. Start. Imagine my patient is only 3 weeks after the birth, and we have to reduce the water retention. I use a big electrode and start to stimulate a very important and main ganglions. Do you know what that means, ganglions? Do you know what that means, ganglions?
Can you spell me?
G-A-N-G-L-I-U-S.
Yes.
They're lymphatic and vascularization relationship, okay? This is for physiotherapists, not for commercial, not for managers.
Yes, later on I will ask you once again with this word specifically.
What?
I will ask you once again specifically with this word because I cannot find it right now.
Ah, okay.
Okay.
So I start to stimulate with deep CET in high temperature.
Okay.
Only for a second. I tell you, deep CET, and I increase the intensity about 50, okay? 50%. And I use hands. Can you see?
Yes, now I can see. It was buffering.
Inguinal to inguinal point. During 1, 2, 3, okay, 5 or between 5 or 10 seconds, and I stop, and again I repeat 3 times. Again, to stimulate because these points are very important to drainage. Okay.
Okay.
Stop. And the last one.
Finish.
Okay, finish. And the other side. A little massage on circle with a little press. Stop. This is very important to do before the treatment because then the drainage will be better.
Open the node, lymphatic node.
What?
To open the lymphatic node, is that right?
Yes. Three times during 10 seconds and in high temperature.
Okay.
And in abdominal too.
Okay.
The last one. So now we start really the treatment. I have to put loud pulse because we are imagining my patient is so ill after the bath. And I put loud pulse, put about 20%, okay? The size of electrode. And now I am going to do a clockwise massage to do drainage, okay? We have two ways to do the massage. One of them, and I normally use that, is doing the massage in clockwise. But there is another in 4 quadrants. Okay. Then when we finish, I show you. Okay. I like this. I like this better.
Okay.
And I do drainage with a low pulse.
So clean.
Okay, this movement we can do about 10 or 20 minutes, but in the same time I see that the water retention is to go down. I use RET, okay?
Okay.
Perhaps 20 minutes, for instance, for all treatment, but 10 for CET and 10 for low beat. If the water retention is so high, in the first session, only use CET.
Okay, no RET.
But, yeah, no RET. But if the water retention is, or inflammation is not so high, I use directly RET in the first session.
Okay.
I put low beat. Low beat, and I increase about 40. Okay.
Yes.
And now during RET, I am asking her to do exercise. I ask her, please inhale, and when you exhale, try to go into your tummy. Okay. So in this way, I am working, and here transversus abdominal is working. Understand?
Okay.
Okay. And into, and her abdominal, transversal abdominal is contract. So I can feel the heat increase a little. This is good. Okay.
Okay. Okay.
Okay. Imagine my patient is about 6 weeks after the birth, so is much better than now. And I ask her, so difficult exercise. For instance, this flex, and ask him, come on, inhale, and when you exhale, came with me with your legs and your tummy into together. Okay. Breathe. And the other side. And your tummy into, your tummy into, your tummy into. Inhale. Okay. After. Okay.
Okay, understand.
Then I can ask her like this, more difficult, right?
Yes.
In this picture, the patient has the bracer on his ankle. Can you see?
Yes.
But I normally doesn't use that. I put directly with the electrode on the tummy, but this is another option. Okay. So I can ask her in the same way. As, come on, up, a little up, and your tummy into. Your tummy into, exhale. Go down, inhale, okay? And I ask her during the session so hard as she can, because the abdominal transversus are total off when they're pregnant. And it's very important to recover so fast the abdominal girl. And only when the first session is the best. This is the most important. And the woman recover a lot of sensitivity and proprioception of her abdominal girl, right? Okay. Now I have to clean the skin, because with the cream, the fixed plate doesn't work. Right? Okay.
배누르 할 때 원래 배에다가, 그러니까 배를 누르면 방광을 자극하잖아요. 그러면은 좀 더 쉬운.
근데 하나
그러니까 이 원리가 드레이니지를 시켜가지고 배뇨 작용을 도와주는 거고, 배뇨가 되는 시점부터는 이제 그 압도미널 거들이라고 하는 게, 제가 지금 이해를 하는 게 골반 아니면 배를 감싸고 있는 복수라고 해야 되나? 복수는 아니고 뭐라고 해야 되죠?
올라가는 거
뻗는구나 물론.
애를 잡아주는 거?
근데 만약에 얘가 직접 보여주고 트리트먼트 하는 프로토콜.
Now that I use two fixed written plates, electrodes, and I put one of them on the abdominal and down abdominal. If in the next picture we will see about diastasis abdominal, but now this isn't the problem. We are going to treat only abdominal transversus and recovery during the first week.
Okay.
So the position of this electrode is under the umbilicus. Okay.
배꼽 밑에. 나중에 이 영상으로 주지만 이 파트별로 사진 찍어서 이렇게 만들어서 줘야 될 것 같아요.
I know that this fixed electrode normally doesn't work during the 10th.
Yes.
I bring, okay?
Okay. 접착력 떨어지니까.
No estoy buscando. Okay. This is very important to use this technique after the birth. Every old woman, when they have a baby, her tummy is all out, and all the organs could be suffer a very big disorder if we can change that. Okay, so in the first session, it's very important to treat that. The woman what does in this way. So I have to train with her, try to be taller. So in this side, her tummy is going to automatically. So I have to treat that. But there is a special technique in Spain and in Europe we are using a lot, is with a wood. Look, this is a wood, only a wood, 1.5. Okay, a trunk.
A half circle.
Yes, and this is very important to use that, or another a middle bosu ball, or something which is unproprioceptive, because is the main important to contract automatically the muscle I want to treat.
Okay.
So I ask my patient to put on the trunk and to try to be good, correct. Flex a little your knees, and your pelvic must be not too down, not too in front, in the middle. And now try to be taller. And inhale, exhale, and try your tummy perfect, your tummy into. During the treatment, I put the wing back and low pulse, obligatory, because if another case, I can burn. I have a colleague in Mexico who hit her patient a lot, a very big scar, okay? It's very important to remember the skin must be so clean after and before to put the fixed electrode, and it's very important to use low pulse. Okay. When I put the fixed electrode, I don't use high temperature. I know the current is going to, and it is across the skin, and the metabolism is okay, but now is the moment to treat with high temperature. Okay.
Okay.
Okay, it's enough. Now come back. Okay, my colleague finished, and we go again and continue with another pathology. Everything is clear? Okay, continues. Everything is clear? Yes?
Yes, everything is good.
Okay. This perineum. This is a typical pain the woman feel in her vagina.
Okay.
Look. Sometimes women feel pain. Sometimes women feel pain in the beginning, or sometimes feel pain in death. This is this perineum. Okay. And endometriosis is that this type of tissue is born and growing in another place, and he provokes a lot of pain when the woman are with menstruation, because when woman is with menstruation, this tissue is inflammation and then broke and goes down. This is blood, okay?
Okay.
And when this type of tissue grows in another thing, it's so painful. This is endometriosis. And chronic pelvic floor, chronic pelvic pain is very typical, but sometimes the pain is in abdominal, sometimes is in ovarius, sometimes is uterus and another place, and or perhaps in anus. So it's very multifactorial etiology. Okay, endometriosis. This is a very important disease, and I would like to talk that in Europe, many doctors are studying about that, because they say that this is an inflammatory process. Perhaps we shouldn't work radio frequency, because there is a scientific study who said that perhaps we can increase the growing of this abnormal tissue. Understand? So
abnormal?
What?
Which tissue you mentioned? The tissue name.
The teeth?
Tissue name.
Tissue name. Endometrius.
Endometriosis, I know.
Yes. This tissue called endometrius, and the disease endometriosis. Okay.
Okay, understand.
Okay. So sometimes some people says that the hyperthermia or radiofrequency, perhaps we can go worst with my treat, because perhaps I can provoke this tissue grow a lot in another side of my body, because the metabolism is increased. Do you understand? So there is a very controversies about that. But I use in endometriosis, but I use with carefully. So okay. I don't use a lot of heat, and never. This woman with endometriosis only have pills anti-baby, because when they don't have menstruation each month, it's less painful for her.
Understand.
So when the woman is taking pills, anti-baby pills, it's better for treat, because I am sure that the endometriosis is off, stop. Understand? But okay, for this disease, my colleague and me, we have a lot with many patients with endometriosis because they feel a lot of pain, and some of them are has suffered surgery because the doctors do a surgery to take off this type of tissue, which it shouldn't be in this place. So sometimes they do a surgery and take off this type of endometrius, which is perhaps in the head or in the abdominal or in the bladder even. And we have to treat after the surgery. It's very important because the fibers of the abdominal surgery, they are very important, and in the future they will provoke a lot of pain, a pelvic chronic pain after the fibros for the surgery. Okay, so to sum up, in endometriosis, we do mainly two types of treatment. One of them is when the woman doesn't do any surgery, only is her disease, and she feels pain. So I recommend and I advise her, if it is possible, she take anti-baby pills. It's better, but the doctor is they have to say her if it's okay or no, not me. But I do a treatment only for pain, and I do with my bracers, okay, and I do on my hand, on the imagine. Then we will do the same with my colleague. Imagine the patient is lying on the table, and I put my hand on the pubis and the other on the sacrus, and move a little movement and type, not a drainage, but it's a soft mobilize. And this is very comfortable treatment. Okay? Okay. And I do, besides that, a little treat on her tummy to look for some place where there is pain or retraction, and I try to solve this tissue. But it's very important to remember that we can't increase a lot the temperature, because we don't know really what happened when I am using radio frequency in this type of tissue outside of her own place. Understand? Understand. Okay. The second way I treat in women who suffer endometriosis is after the surgery, and in this moment, I have to use a little high temperature because I have to break these fibers. Okay. So in this case, I put in the picture, I use about 40 on 60% with RET electrode, and try to do a roll up massage and very hard massage. Okay? Okay. Continues. Chronic pelvic pain. Chronic pelvic pain or chronic pelvic pain, it's very common pain in Europe. I don't know. I don't read a lot in Asia, perhaps too. But when women in Europe, we are running a lot, and the pelvic pain is very common, and in men too. Yes. Okay. So there, in this topic, there is a little more scientific study, but really they don't know where the etiology. So when we have this case, we treat all, okay? Everything which is possible to provoke some pain in pelvic, we treat. Muscles, nervous, abdominals, organs, bones, everything is in relationship with the pain we will treat, okay? And this is a very common word to use. Accumulation ischiadica. This is very common to treat in Spain or in Europe in general, and is inflammation in general in abdominal. Okay, it's a very big inflammation, but not only in one side, it's in general in all abdominal pelvic cavity. So we will use the same way dynamic, CET dynamic, because we need to treat all layers of tissue, organs, muscles, vessels, nerves, and the same way we do in the first week and the third week after the birth, with massage in clock weeks, okay?
Okay.
In 30% approximately. So we will treat a pelvic and lumbar muscle with CET dynamic. In this pathology, I check, for instance, the muscles. This is not for pelvic, not for pelvic floor, but it's near the abdominal in general. So I will treat the pyramidal, I will treat the lumbar, I will treat the abdominal, rectus abdominal, transversus, obliquus, everything in relation with that. Because sometimes the pain is provoked for stomach or for a contract in their muscle. And after that, firstly, I treat the muscles, and then I will treat joints, all joints, and pubis and sacroiliacus, okay?
Yes.
And with hip too, and ribs, okay?
Okay.
Vertebral conjunction lumbar holes. What does it mean? This, the vertebral has a hole, look, and across this hole in lumbar, the other vertebrae are inside,
Yes.
go across the nerve. So it's very important to treat this articulation.
Okay.
To treat that, I need RET, of course, because it's bone and it's so deep. I increase temperature even until 60%. It doesn't problem.
Okay.
Only for the treatment, okay? And finally, I will do a treat in intravaginal. And if I have a man, sometimes I have to do intra-anus treatment or to treat contract inside of the pelvic floor really muscles, okay? But when I do this treat, I will do with the bracers, and I put my fingers inside. So normally in all treat, when I do this type of treat, never increase more than 30 or 40%.
안쪽은 무조건 30 이하. Okay.
Okay, continues. And this is everything about chronic pelvic pain, because it's very big.
Very large, yes.
Yes. Okay, this perineum. There is two types mainly. One of these is the woman feel pain in introitus or in the beginning. This is in this part, okay?
Okay.
And sometimes they feel pain in the deep, okay?
In inner area, yes.
So if the woman feel pain in the beginning, here in the beginning, we will use CET dynamic between 30 and 40%, but I need not warm or cold. I need a comfortable heat, okay? We need a vascularization would be good. We need a lot of blood there. And we have to treat a lot. Then we use RET with intimacy electrode, the small one.
Yes.
Because
Convex.
Convex, yes. Wait, in the first step, CET dynamic, I normally use big electrode, not big electrode. I like to use the big one. Okay? And then for directly or the C feels pain, I use the intimacy electrode RET around the vagina fork. We say fork, okay?
Fork,
This
yes.
part, this place, we say vaginal fork. And finally, we use bracers doing the perineal massage inside, but not so deep.
Okay.
In the beginning of the vagina, okay? And try to do a good laxity in this tissue, okay? Okay, if the woman feels pain on the deep, there is another different problem. So
okay.
We have to change the treat. In the beginning, it's the same.
Pain.
When I use CET dynamic, I am sure I am working on the depth, and this is very important. So in the beginning, it's the same step than the last one. And when I get the heat is okay in all vagina, then I use RET, but in this case, weak electrode in all pelvic floor.
Okay.
Anus and pubis. Be careful. You have to advise your professional, be careful, don't touch the anus, because we can provoke some infection in urine infection if we touch that and then that. Understand?
Understand.
So this part we say fibrous nucleus of perineum, and this is the place we start to do the massage with RET electrode, a big electrode, to the pubis bone. With comfortable heat too. In this case, if the woman isn't so slim, I can get even 60 or 70%. It's so high, I know, but I have to check with my patient all the time how many heat is he feeling, okay?
Understand.
Then when I finish to do that, I use my bracers again, and I put my double gloves again, and I treat deep contract and limitation of movement in the uterus neck, because this is another cause which provokes the dyspareunia in the depth. One of them.
What is the uterus neck?
Neck, okay. Neck is this. No, my neck.
I know.
But but this is uterus neck.
Understand.
Okay.
Understand.
Understand? Okay.
Yes.
Sometimes the pain is provoked with the contract deep muscles. Okay. However, sometimes the pain is because there is some limitation of the movement of neck, uterus neck.
Okay.
Right? So sometimes after the cesarean, or sometimes after the pain menstruation, or I don't know why, there is a limitation of the movement of the uterus neck. So I have to move inside. I am with my finger inside. I do a little movement and I check my uterus moves in all direction.
Okay.
Right? This is very comfortable for the patient. And sometimes I use one finger inside and with another bracer outside.
Okay.
Imagine? Yes?
Yes, I imagine.
Okay. Imagine I am here, look, and I put, wait. I am put one finger inside. Oh, okay. I put here. Here, no, ese es anus. Aquí. Aquí digo yo. here,
Yes.
I put my finger, and the other hand is down, outside. So
Abdominal.
I move with this hand in this way with the uterus, and with this finger with another. Do you understand?
Yes.
With the bracers. So this is very, very, very effective treatment, because I treat the uterus inside and outside in the same moment. And besides that, you remember that when I'm with my bracers, my hand is in RET mode, and the inside hand is in CET, because I am with my gloves. Do you understand?
Understand, because it's like using as a CT electrode with glove.
Yes, it's RET really, but when I use gloves, they convert to CET. So in the same moment, I am doing a treatment with 2 types of current. So I am treat everything. And normally in 1 session is enough. Okay? Good?
Nice.
Nice.
Yes.
Do you need we do the demonstration again, or do you imagine in continuous? Tell me.
어떻게 할까요? 데모를 볼까요?
네.
Okay, I prefer to do demo, but can we have a 2-minute break time to go to the bathroom?
Okay, of course.
Okay.
To have a coffee.
So let me have a 2
2
minutes.
minutes, okay. Okay, I wait you. No, se ve que va a coger algo, no sé. Muy bien, ¿verdad? Tú eres española.
Ya, eso sí es verdad. Porque claro, ya en los
Pero
coreanos
yo-
cuando hablan inglés se entrarán entre ellos.
Pero claro, no ves que dicen, no dicen think, no dicen la Z, ellos dicen I think.
La gente no sabe español.
No, no voy a parar. No, porque ellos, por ejemplo, ayer me decían, tomorrow.
Tomorrow. ¿Qué tomorrow?
Es que más de entero.
Tampoco dicen la W. Tomorrow. Ah, la R.
La R no la dicen, te la dicen como L. Pues lo hice ayer todo esto, ¿sabes?
¿Qué te acostaste?
No, lo tuve que hacer por la mañana. Me levanté a las 6 y terminé a las 2
Bueno, ¿de la tarde?
de la mañana. A las 6 de la
De
mañana.
hacer todo lo que tenías que hacer.
Claro, cogí un paciente que tenía que cogerlo y estuve desde las 6 hasta las 2 con esto. Y de 9 a 10 paré, cogí un paciente y luego continué. Y luego ya comí y me enganché a trabajar a las 3 y media por ahí, hasta las 9 y media. Y esta mañana me he levantado porque me había arrancado toda la uña, entonces digo, ¿cómo voy a dar la clase con una uña así o otra uña no? Que se me ve. Entonces me la he pintado corriendo y ya me he venido para acá. Se ha roto el coche, mi hijo estaba mal la noche, me dormía a la 1.
El coche, el mando se carga has dicho en la guantera.
En la guantera, pero en la esa que va en el medio. Lo llevo ahí como, yo meto mi móvil y se carga el móvil ahí, ¿sabes?
Porque es la batería. Es como una batería.
Como si fuera una batería de esas, se cargan algunos móviles. Y la llave se mete y se carga, pero yo hace ya meses que yo no lo he cargado. Y si ve que se ha quedado sin batería, uy.
Tú sabes que estas cosas siempre pasan. El día que no puedes, se te descarga. Pues ya sabes que con el
¿Lo habéis puesto a cargar o no?
está cargándose ahí fuera.
¿Por qué se ha ido Paqui?
No sé yo. Está fuera.
Ah, pues me ha dicho...
Te habrá dicho hola.
va a dicho la que ha venido,
No,
claro.
fuera, no. Porque ha venido una privada, y eso que he dicho, que no le he metido solamente en el Google Calendar y en la agenda. Porque no está puesta, no sabía si tenía la mutua o no. Entonces he dicho sí a las 5, no sé qué. Vale, pero claro, no sé la mutua. Entonces lo que estaba diciendo.
Vale. No he desayunado ni nada. Ahora nos hacemos un café.
Pues yo quiero dulce. ¿De que lo quieres?
Sí, de ese de vainilla que hay, que no lleva nada más que ni azúcar ni nada. Es nada más que la cápsula y ya está. Si hay leche me echan chorroncillo. Tenemos un descanso de 1 minuto. Que tenemos un descanso de 1 minuto. Estoy dándole clase.
Back.
Okay, everything's okay? Continues?
Yes, please.
Demonstration. Okay. In the endometriosis, the first is like this. We have just done with accumulation ischiotica. Have you look? What does it mean?
No.
No. It's a big inflammation in general in pelvic. Okay.
Okay.
Congestive inflammation. So we will do the CET dynamic like before, and then I am going to show you the how I do with my bracers. Is bracer technique. I don't know. I imagine in Asia you do the same way, but
Yes.
we say in Spain. Myofascial liberation. This is
Understand.
a typical technique. Do you know? Okay. Well, so this in this pathology we do that because the woman feels a lot of pain, and this is very comfortable. So I am going to put there. María José, vente y lo hacemos. Sí.
우리 때문에 끊기는 거예요. 지금 여기에는 이 신호가 계속 잘 나오거든요.
근데 RT 이게 이런데 손으로 해. 그래서 좀.
그러니까 이거는 막대잖아요. 되게 예민한 부분이기 때문에 이제 그 트리트먼트랑 좀 측정을 하는 것 같아요. 내 생각에는 예를 들어서 그 뭐 아까 전에 자궁목이라던가 그런 쪽이 열렸냐 안 열렸냐 움직이냐 안 움직이냐에 대한 부분 아예 모르기 때문에.
So I have to use the
return plate, two bracelet, dual bracelet.
I don't know what double cable.
Dual cable, yes, double cable.
It's not necessary to use cream. The return plate I put down.
약간 골반이랑 엉덩이 쪽에 되는구나. 허리 쪽이 아니야.
So I put, you see me, okay?
Yes. 30% CT dynamic.
I am trying to use 30%, okay? Not loud pulse, not everything. In the first step, I don't do again, is the first typical massage in clockwise, okay?
Yes.
Loud pulse. Take out the water resistance. So I imagine I finish that step and I start the next and put one of my hand on the pubis and the other on the sacrus, okay?
Yeah, okay.
And now, and I have to feel the movement the body has on itself, okay? And I have to, we say in Spain, hear technique. We hear what is telling us the body, right?
Yes.
So if I feel my head wants to go to one side, I hear and I access to go to this side. And I wait what happened. And then I try to return to the correct position. You understand?
Yes.
This is a technique of physiotherapy, so, but it's very important to know what I am doing. And when I do this technique without radio frequency, it's so slow, so slow. However, when I use, not only in pelvic floor, even in all treatment or all body, even in head or cranius or even in a knee. The time I need to do this technique is so short, okay?
Understand.
And when I feel the body is okay, I can move on this. I have another technique to move a little, not quick, big, a little big movement. And I will do this, okay? You see, I put pelvic bones and sacrus. And I move to pelvis, go behind, and go outside. See? Do you see?
Yes,
Can you see?
I can see.
Remember that endometriosis is very painful. So I shouldn't do any pain to my patient. She's very, very bad. So it's very comfortable for her and very effective. Only we do that, okay?
Okay.
I imagine that my patient has a surgery because the best way for pathology is taking out the tissue, the blood tissue. So in this case, I use electrode, RET electrode, okay, big electrode, and I do with high temperature because I put where I see the scars and try to eliminate the fibers of this scar because I know these scars are in the depth, not only in the skin.
Okay.
Right? RET, and I increase the intensity about 70%. If you think your physiotherapists are very dangerous, only tell them increase after 50. Okay. Do you remember I work so high always?
Yes, understand. 1050.
Normally, there are 3 scars because the surgery they do with laparoscopy. So,
Lucia, we cannot see the treatment because it has blocked the screen. You should to put down more, please. Thank you. Thank you.
Yeah. Normally, I am telling you, normally there are 3 scars. No, because the doctors do the surgery with laparoscopy. So they use 3 holes to access into the pelvic organs. Okay. So in this point, one of them in the umbilicus, under umbilicus, and the other on its side of hips, there are a hole when they put the camera of the tools they need to do the surgery. Understand?
Yes.
So I have to treat that. I increase a lot the temperature in this point, only in this point, to the vascularization is very, very high and the metabolism is a lot. And in this moment, I can do massage, strong massage and deep massage and roll up and to take and to broke the fibers. Okay. So imagine we have a hole there and I do the massage, deep massage with my electrode in high temperature. Normally with 2 or 3 minutes, it's okay. Because I am working in a high temperature, okay?
Yes.
Then the other. If we want the temperature increase faster, we can use a small electrode.
Yes.
But normally I use a big one because it's more comfortable, and I can do comfortable massage with them. But if I feel that the fibrous is so hard, I use small one because I increase the low temperature and then broke. Okay.
Okay.
And the other three. When I treat 3 holes, then I can do the roll massage with bracers and to take out. Wait, now I am going to show you. Okay, when I finish, I feel the temperature of my patient is so high, but it's okay, you feel okay. Now I change and I put 1 bracers. And now down the intensity, of course, and I put about 30 or 40 at all. Okay, 40 is okay. And now I have to do a roll massage. Can you see the roll? Yes.
Yes, rolling.
Rolling. Even when I finish, without bracers, without cream, without a matching device, anything, I use a paper. Do you want I show you?
It was disconnected.
It's okay?
Yes.
Okay. Okay, I do massage and deep massage and broke the fibers so hard as I can. But when I finish, look, this is my technique. This is not from winback, but I am going to show you.
Okay.
Okay, I use a paper because now is the best moment for this tissue. The tissue is with a lot of blood. This is a lot of vascularization. This is the main moment of the metabolism is growing. So it's the best moment to do any technique. So I use a paper and put inside, put on the skin, and I feel and I check my skin with a similar roll massage, but I up. After that,
Okay.
if I do that, radio frequency is so painful for the patient, and it's not effective. But if I do when the metabolism everything is with a lot of vascularization, it's not so pain and it's so effectiveness. Okay.
Okay.
Okay. The pelvic floor. No, the chronic pelvic pain. Okay, I do the massage with show everything. Do everything.
In short minute, please.
Okay.
Yes.
I told you and I show, but I am not going to do. Okay.
Okay.
With CET electrode and dynamic mode, I use 40% more or less, and I treat all lumbar muscles. I do the massage in not lumbar and pelvic muscles. Okay. I ask her contract, move, and I ask move and try to come here and come. Try to go there, up to the, okay, and ask her every time move it and contract the muscles. When I finish the muscle treatment, I use RET in joints, the main joints, in sacroiliacus, in hips, in pubis, and in lumbar bones. Okay? Then, with the same electrode, I increase a lot, if I can, the temperature, and I put in holes when the nerves across. Okay. And then when I finish that, I put my bracers and go intravaginal and to take off the contract of the muscle. Okay. If this is the vagina, I put inside and I do the massage in not of muscle down or the side or in top.
In order to improve the moving. In order to improve the like movement inner side, is that right?
Yes. Yes.
Okay.
But the other is the same way. The same way when I talk about the dyspareunia, but this is another pathology. Okay. In pelvic floor, they normally didn't pain in one place. It's in general.
Yes, understand.
Okay. But in dyspareunia, I saw you in the model. Okay. So in my patient now, we are continuing.
Okay.
Okay. Okay. Disorder specific of pelvic floor. This is the most important I treat every day normally. Incontinence. This is the This is the most typical pathology we're going to treat. And there, imagine in Asia is so common too. The most of incontinence are of urine, okay?
Yes.
For this, you see, for this disorder, we use deep CET on pubis bone. Why? Because I remember, this is very important to understand. Imagine, ¿dónde está el útero? ¿Dónde lo veo? Ah, está aquí. Imagine my patient is lying on the table, and this is the bladder.
I cannot see.
Oh, sorry.
Okay.
This is bladder. And this is uterus. Okay. If my patient is lying, the bladder is here, just under the pubis bone, right?
Yes.
So I do the treat. I need to across every layer to arrive the bladder. So I need deep CET because bladder is a soft tissue, and I need deep CET to arrive it, right?
Yes.
And as I am in CET deep in the depth, I can use a little higher intensity because it's not uncomfortable. It's okay. I can use 40 or 50%. If I use only CET mode, I can't use this intensity because it's so high.
Yes.
Understand?
Yes.
So in this way, I use deep CET on pubis bone, and I do a massage for bladder, right?
Okay.
And then I treat bladder, but I need to treat urachus ligament because the urachus ligament after the birth is so slackened. So laxity. I need to recover the tightening, right?
Okay.
Urachus ligament is from bladder and goes to the umbilicus. This is the ligament from here and up to umbilicus. This is important to treat it. So to treat the ligament, I need RET electrode because it's a hard tissue. And I use 60 or 70% because I need to increase a lot. I need hyperthermy, right?
Okay.
To stimulate the collagen of this ligament. So I advise you use a small size of electrode to increase a lot temperature and to do a massage in this direction for all way of the urachus. Okay. Then I use RET, but a big size, and vagine here. So the first step, I have to treat in abdominal place, and after that, I am going to vagina.
Directly.
Okay. I use a big size and put about 50 or 60% because I need high temperature, not hyperthermia. In vagina, never use hyperthermia,
Okay.
only vascularization, right?
Okay.
And then I do so many minutes as I can with RET because remember the most important thing of all webinar. RET electrode is key to recover the collagen on laxity tissues after the birth or along the years with menopause or anything. So the RET electrode is the best. I use this one on the vagina, the big size, because I recover all collagen of all vagina, and I can the possibility to go into because RET electrode is so deep and so hard, and it's the best for that. And when I treat everything in general with RET big, then I use razors and with my finger, one finger, but look. This is bladder, right? This is
Yes.
This is urethra, right?
Yes.
So when I put my finger inside the vagina, I look my finger to the urethra. Sometimes, imagine this is the woman. Normally, I put my finger in this way, looking to the floor. But in this moment, I have to turn my finger and look up in the
upper area to reach to the urethra.
Yes, directly on urethra.
Okay.
Urethra. Yes, and I have to check the urethra is in good position, in correct position, because sometimes after the birth, some ligaments of its size can broke or a lot of laxity, and the urethra is not in a good, in a correct position. So in this moment, I have to check if it is rectus or is to left or to right. And I have to correct to position in the correct way, right? And I advise you to using low beat.
With bracelet?
Low beat. Low beat mode. Why? This is mine. This is not for winback. I am telling you my secret.
Okay.
Why? Because when I use low beat, I am using another electrotherapy more than it provokes a little contract or deep muscles. So I need the urethra is okay at strong.
So let's summary. So when you using the bracelet to reach to the urethra, and at this moment you can using low intensity with low beat. So in order to
low intensity, yes, of course, low intensity.
Yes, in order to make a contraction and relaxation.
Yes.
So it is more easy to move in correct way.
Yes.
Okay.
But really, the urethra doesn't move at all. No, not really move. But
Of
the
course.
small muscles receive this electrotherapy, so it's very important for the recovery. Understand? But really, the urethra doesn't move at all. Okay? No.
Yes, of course, I agree.
Okay. And Another type, okay, finish in urine incontinence, okay? We will talk about the fecal incontinence. Sometimes there are women who suffers fecal or some incontinence with the anus. So in the beginning, we use now a CET dynamic directly on anus, right? This is the anus. Okay. Directly in anus, I use a medium size electrode, CET. Remember, you have to put a cover.
Of course.
Cream, cover, cream, okay? And you use in dynamic because I would like to treat not only external sphincter anus, because I need the deep anus too, okay? And then I use about 30% is okay, because anus has a lot of sensitivity. And if I use a lot, patient feels burn. So 30 is high. Perhaps sometimes I have to lower down. And then only in anus 2, I use RET, but in this way, perhaps I can use 50 or 60%, but it depends a lot of the women, right? But remember, in this case, I need a comfortable heat, not warm, not cold. I need heat really, because in the other case, I don't get, I need.
Understand.
And after that, I use bracers with finger, with double gloves, and go into the anus, right?
Yes.
And ask exercise program. I have to do a training with her anus muscle, with muscle anus.
How?
I ask her closed and keep closed while I am telling you. Even I ask, now inhale, and when you exhale, try to go to tummy into that I teach them before. Besides that, you have to contract your anus and keep closed while I do, while I telling you. Okay? Understand?
Yes.
In urine, I do the same way. Not only put in urethra and I am having a rest. I put and I ask her to do a contract and to keep or relax, or now keep, now relax, okay? I am changing, even the problem has the woman, right? Remember, every time I know I am so heavy with that, but it's very important. The patients are doing exercise while they are receiving the current, okay? In all treatment, in all treatment. I don't mind if it is so inflammatory process. I don't mind. I do low exercise, but every time we have to do. Remember. Okay. Continue. Here, an episiotomy. Okay, this picture is from my patient. This is real. This is from my patient. Everything's okay?
Yes. Okay, understand.
Tear and episiotomy. This pathology are provoked during the expulsive birth, while the baby is go out to the world, and sometimes the fork vagina broke. Sometimes
automatically. It's not operated by doctor. It's like a naturally tears, right?
Tears is automatic, and episiotomy is when the doctor cut.
I understand.
But really, more or less, is the same. Sometimes the nursery or the doctor decide to cut, hoping that the heart was less. But sometimes when they cut, the broken is bigger. It's sometimes is automatically and natural, and sometimes the doctor cut. When the doctor cuts, we say episiotomy, and when it happens the natural way.
We call it
tear. A tear, yeah. Okay. When the wound is okay and is closed, then we can use cream. Okay, remember I told you before. We use directly on a scar with CET dynamic with warm temperature. Be careful, because when there is a injury, the sensibility is affected. So perhaps the woman doesn't feel okay, so we can burn. It's very important to check all the time the temperature.
Okay.
With our hand, or perhaps to put, if I see the tear is here, perhaps I have to put the temperature here and ask my patient how many heat is she feeling. Okay, yes. Because this
from 0 to 10.
Because in this place the sensibility is not too good. Okay.
Okay.
Then I use RET, small electrode, for intimity, and do a little pressure to try to recover the laxity correct. Because in this tear, they would be fibrous. It's normal. So I have to try to recover the normally laxity. Do the patient and a scar, warm but comfortable heat. If I treat the tear after the 3 weeks, I only use warm and a little pressures. However, if the episiotomy or tear came to my clinic after 1 or 2 or 3 months or year, I have to increase a lot the temperature and the pressure, because it depends if the problem is acute or is chronic. Okay. About strong or my pressure, and about heat, right? And bracers, after that, it's very important, not for the heat really, for the message I can do on this skin and to recover the laxity, the correct laxity, right?
Yes.
And this is very comfortable, right? This is easy disorder. Okay, this is a very important disorder. This is very important, and this is very common. I have read about 50% after the birth of woman suffer a prolapse during her life. So
how many percent?
50%.
50%.
50% after the birth. There are 4 degrees. Not every woman has a deep prolapse, of course, thanks to God. But it's very common. This is a patient, my patient, and I want to do a scientific study about that, because there are 4 degrees. Okay, listen. For first degree, it's okay, it's normal after the birth, and when we finish, if you want, I can show you. But the problem is when the prolapse of the organs go down of the vagin tissue, like this. Okay, we say between 1 grade and 4 grades. 1 and 2 grades, normally physiotherapists treat and improve a lot with electrotherapy, with radiofrequency, with exercise, with a training exercise of his postural body. However, in 3rd and 4th degrees, physiotherapists don't active. so directly go to the doctor to surgery.
일에서
However,
생각하지 않아서
however, at my clinic, I have 2 cases in 4 degree, and I recover at all. So it's amazing. And the doctor phoned to me because it's amazing. It's not normal because the woman was recovery and take out of the surgery. Okay, I have to treat every month or every 8 months. She has to work her body, but it's out the surgery and her life is beautiful. Okay.
Okay.
So I am doing the treatment with winback, of course, and another type of electrotherapy. But I think the main important cause of the improvement is winback and the way I am using. Okay, I'm not using the program Chris sent me, so I changed a lot, and I put here like I am working because I would like the Asian woman would be better. Okay.
Okay.
Well, we have to recover all tightening as it is possible. This is the main important thing because this problem is because the tissue was laxity a lot. So we need the tightening, it would be the best as we can. The collagen is the key. The collagen is the key. So to stimulate the collagen, we have to treat with RET, right? However, I am used CET because it's very important. The muscles are strong because they have to support the weight all the time during all the weight, right? So I use CET dynamic for 2 causes. One of them to vascularize the muscles in depth and in surface, and because I want to vascularize the fibrous nucleus perennial here. This is another very important point in vagina because here cross a lot of muscles, and here a very important point we have to have hard but laxity. It's a very important point. A point has to be correct. If this point is laxity, all my pelvic floor and all my organs down a lot, and it is very common to suffer an incontinence or prolapse. But if this point, and on another hand, if this point during the tear or episiotomy, the continues or wait, Derek?
Few seconds.
Wait. Yes, yes.
팀장님, 제가 지금 여기 세미나 중인데 혹시 6시 넘어와서 전화 주시겠어요? 6시 반쯤? 예, 감사합니다.
Bueno, no lo sé si vamos a hacer. ¿Ok?
Ok.
Ahora le decimos, vamos ya fuera de tiempo, pero lo mismo. Okay, this nucleus is very important for two
Reasons?
Yes, thank you. Because it has to be so strong to support the weight. But if, on the other hand, if this nucleus is so hard, it's pain for women. So it has to be the correctly tense.
Understand.
And sometimes when women have a baby and the doctor cuts or the woman suffer a tear, the fibers, if the injury is in this direction, is very painful here. So it's a point I have to treat every time in my woman. Okay? So to stimulate this point is with very collagen. I use RET, correct. But I have to use CET because I have to vascularize a lot this point too. Do you understand?
Yes.
Yes. Right. And finally, the key and the secret of the prolapse treatment is to treat with RET, a big size of electrode, even on 70. if Chris hear me, they
Yeah.
are going to.
Okay.
Not so high, Lucia. Not so high, Lucia.
Okay. Secret
When,
between us.
when I went to Korea and I finished my my workshop there, he told me, don't they work so high temperature? It's very dangerous. But the really important things I get is with high temperature. So I understand the physiotherapists, when they do this protocol, they have to be do before a lot of treatment, not directly with high temperature. So it's during a time with a month with the machine when you are a security to use this temperature. Okay. And I use even 70% on my patient. But the most important thing is doing hypopressive exercise, right?
Exercise, yes.
I ask my patient do this hypopressive. So I am going to show you with my colleague with clothes, but I am going to show you the way I do, right?
Okay.
And finish this topic, and only we have another 2 topic more. Okay, there is a lot more, but for today, I think it's enough. I am going to show you another 2 more, and I am going to show you how I treat the prolapse with my colleague.
Okay.
And we finish. Abdominal diastasis. Abdominal diastasis is very common and normally after the pregnancy. Okay, sometimes broke the fascia rectus abdominal. So this is very bad. Normally in physiotherapies is the fascia is we can do a lot. But if the fascia is okay, or only the broke is so small, or only is slackened but not is slackened but not broke, we have a good effect, right?
Yes.
We need to treat in all abdominal place CET dynamic during a few minutes with high temperature, because we have to stimulate the vascularization. All the time is the same. And then the K is RET again, because the fascia is a lot of collagen tissue. So we need high temperature, and we ask my patient do exercise where the rectus abdominals are closer. Because in the same moment I input the radio frequency, the abdominal are going to be closer. That I want that. So it's the best moment to put a current, right?
Yes.
I am going to. Do you remember the first time when I do my patient, I ask her inhale and try to go into the tummy. This is a good way. And the other to look up, and your tummy into. In this moment, the transversus and rectus abdominals are going to go to a perfect, a good position. So in this moment, I am stimulate a lot with RET, a big electrode with high temperature. But in this case, for abdominal diastasis, in this pathology, we have to treat with multipolar. It's very important. Very, very important. Because
Scar.
What?
Scar.
Scar?
Yeah.
No, not really scar. Here there is. Yes. No, here there isn't a scar, but the laxity of the tissue of the superficial fascia, we have to treat with multipolar electrode, right? Yes. But in the same way than the RET electrode. So the other electrode, and ask her the same. Try to sail to go into your tummy and to contract your muscles, but with multipolar, I increase a lot of heat. So you have to be careful with burn, right? Okay. But to sum up, in this pathology, we have to treat in a very, very, very high temperature, in hyperthermia because it's in abdominal, and I recover at all not, but the best way, the deep fascia and superficial fascia. I only use a few minutes, CET mode, to vascularize a little and to prepare the muscle. But the reason for this treatment is to treat in RET all the time, right?
Okay.
Okay. Finally, in cesarean, when the babies can't go down of the vagina, the doctor decides to do a surgery called cesarean,
Yes.
right? And in this case, we have to use all electrode.
Okay.
Because the surgery is in all tissues. The first layer the doctor cuts is skin, so I need CET. The next is fascia, the superficial fascia, so I need multipolar. Yeah. The next, I will find superficial muscles, CET. Then deep fascia, RET, normal RET. So more deeper, I will find deep muscles. So I need deep CET. And finally, I will find the deep fascia. So I need RET again in high temperature. And finally, to uterus, they code, I need at all the most CET, because in another way, I can arrive to the uterus. With CET normal, I can't arrive in, right?
Right.
So to sum up, I normally use CET dynamic because I am sure that between uterus to skin,
Yes.
all layers of tissue which needs are good treat, and then I will use RET for hard tissue and fascia and fibrous. And during this moment, I ask the patient exercise, right? In this moment, it's very important to do hypopressure exercise, because when I do the hypopressure, I move inside all tissues, and I can help the tissue with my hand to break the fibrous, right?
Right.
And then a bracer to help, but this is not high temperature. And finally, multipolar to superficial fascia, and to break the fibrous in skin and superficial fascia between the first layer of muscles. Okay?
Yes.
Understand everything?
But what I realized that normally I'm treatment along with the layer which is more closer to the superficial. So superficial skin surface, superficial and facial and tissue and bone, something like this, right? But why you mentioned that you will following the like reverse side, is that right?
What? Again, tell me the last only.
You will following the reverse flow from inner side to the superficial area, is that right? Or opposite?
No, because I told you when I imagine all the layers when the doctor is reporting. Yes, and I told you how is in an anatomic position. The first I see is skin, superficial fascia,
yes.
Muscle superficial, again another fascia, deep muscles, another fascia, and uterus. This is the correct, the anatomic position.
Yes.
But for each tissue, we need different electrode. But
so
when
we need to do multipolar first, is that right? No.
You can use in the first or the last. I don't know.
Along with the like order sheet from superbase until the deep muscle.
No, if you want, I normally do when that I am show you, but it's would be a good way if you want to use firstly multipolar. It's okay because you think it's better to prepare the skin before the rest of the radio frequency. It's a good idea too.
Okay,
But
okay.
I normally do that because
Okay.
I am used to do that. Okay, but it's not important, right?
Okay.
Okay, I am going to show you how to do the hypopressive for prolapsus and for cesarea. Okay.
Okay.
And I finished. Here I put in the last picture another pathology I use to treat with winback in menopause to recovery the lubrication in vagina and to painful in fork. And after the breast cancer, we can use to fibrous and to recover the nodules ganglions to try to recover the vascularization is okay or better. And fibromyalgia for pain, a lot of women suffer this pathology and only do a treat with a low heat and dynamic and more suffer. In constipation, we can help then doing massage in clockwise direction and to do a temperature medium, and in menstruation pain too. Okay, there is much more, but this is another.
Okay, maybe we can have a second webinar as soonest. So firstly, it is really nice time to adapt the how to say the pathology and the mechanism of the treatment. So yes.
I think today is a very important webinar because I am trying to sum up all the most important things I do with winback in this pathology, and I get a good results. Okay.
But what I realized that your philosophy is offer the exercise herself during the whole treatment.
While they have the tell me again.
What I realized from you is you always offer let her do exercise on herself. It's more help to improve a lot. Is that right?
Yes, of course. Always.
And second question.
And second, okay.
For your treatment, you only using winback with your finger or winback plus another machines?
In my clinic, I use winback and another. Not
so how many percent
frequency
of your whole treatment for intimity?
And in all patients, I use winback in all my patients. In all my patients. Besides that, I use beside winback another treatment.
Okay.
For instance, for cesarea, I only use winback. And I don't use another machine. For instance, for prolapse, I use winback and another electrotherapy, another training exercise program. Okay. But winback is the star in my clinic, and I use a lot.
Okay.
I'm going to show you this, and it's okay.
Okay.
20 hacemos eso. No puedo más que túmbate.
Tú puedes ver.
Imagine I put the return plate under the sacrum, and imagine with RET electrode, and imagine I'm going to work at 70%. So I start so down intensity about 40 perhaps, but I put directly here, okay, directly in the nucleus, right?
Okay.
And I ask her, come on, inhale.
Incontinence.
Incontinence and prolapse.
Yes, both.
And exhale. All the air out, and close your nose and your mouth and up your ribs. This is the sentence I ask my patient, and I try I am going to show you, wait, what I want to happen in her tummy. Hypopressive exercise. All air out. And when you finish, close your mouth and close your nose and up your ribs. And this way, all the organs are upper. While I am putting on the RET electrode in her vagina. Understand?
Yes.
And ask her to close the muscle. Okay?
Yes.
So this is, I think this is everything.
Okay.
In this area, I do the massage on top of the skirt, and I do the massage like I showed you before.
Like with a clockwise.
In a clockwise? No, in this area it's not necessary in clockwise. In this area, I do massage directly on the scar.
Okay.
Okay?
Okay.
No clockwise. For drainage or for another thing, I do clockwise. But in this area, it's not necessary. I do high temperature when the area is chronic, and I try to break the fibrous. Even with the paper, I show you when I finished to do the treatment with winback.
Mm-hmm.
Yeah, I think it's everything. Have you
one more question for you.
one more? Tell me.
So regarding the endometriosis. So
What?
regarding the endometriosis.
Microsis.
Endometriosis.
Endometriosis. Why? Sorry. Tell me.
Okay. So there are two types. For first one, no surgery. Second one, surgery. So surgery means the abstract the endometrium by doctor.
What? And then tell me again.
Okay. So you mentioned that you have treated to patient with the two type. So first type, no surgery. Second type, surgery.
Yeah.
So in case of surgery,
Yes.
so doctor
Yes.
abstract the endometrium.
No. The doctor take out this endometrium. No, this no.
No.
The endometrius. No. It's impossible. This is a part of tissue of the uterus. But in this pathology, this tissue burns here, for instance. So in surgery, they take out this tissue here, not from here.
Understand.
No, take out uterus, no.
Yeah. So that's why I confused that. Why you
Sometimes,
need a
yes,
treatment for like
not
after
a
surgery?
doctor.
Yes.
You are not a doctor, but sometimes even this tissue burns and grows in head. Imagine. So sometimes the surgery is in the head because they have to take out the endometrius tissue of the head, right?
Understand. 근종.
Yeah. But I told you when they do the surgery, the doctor normally use 3 holes in the tummy because normally the endometrius are near of the uterus. Okay? This tissue is correct here. The problem is when this tissue grows in another place, right?
Okay.
You have to
Understand.
read about endometriosis.
Okay, so actually it was really great time with you, and I guess maybe we can edit some video to share our partners in Asia in advance. After that, what we make a plan that if the COVID-19 situation is over, I will bring you to around to all the countries who interested in intimate. Yes. So I already reported to my boss John, and he accepted it. So that's why he would like to check all the video that how you explain, all the mechanism of the treatment and like a pathology of intimate treatment and so on. So I guess it is really good. It's really, sorry to notice right now. Maybe we can move forward since beginning of last year, but I realize it right now. So let's see how we can make, intimacy market booms up in Asia market. Asian
I am.
reason.
I am. Okay.
Okay. So
We hope the coronavirus is down because now it's a little dangerous. But when it's controlled, we will talk about if I can go or no to Asia to visit your countries and to teach all professionals how to use the correctly way the winback, because it's a